Hi, this is Dr. Nick. I'm the Incrementalist here with incremental insights to improve your business and your health. Today I'd like to talk about testing. So testing is one of the fundamental components for us to be able to return to work safely. Now we have a challenge, certainly in this country, in terms of the available testing resource. So one of the reasons that we're not testing everybody all of the time or on a frequent and ongoing basis, population surveillance, is that we don't have enough capacity. And even the capacity that we do have has some delays in that testing capability. So in fact, if you submit a test, in many of the instances, you can be waiting up to 5 days, possibly longer, for that test to come back. That rather defeats the object, because if it's a positive test, you need to know. So the appropriate way of dealing with this is to put people into isolation until they receive the test back. There are also issues with accuracy of testing, and that's where I want to focus today. And one of the aspects to testing multiple times. So there was a study carried out in a Louisiana correctional facility that surveilled all of the individuals, or the individuals in that institution, almost 100, I think it was 98 in total. And they were tested multiple times, in fact 3 times, as COVID-19 spread through the population. And here's what's important and relevant to note from a business perspective. So for many of those individuals testing the first time they were tested, a large proportion, or at least a substantial proportion, of those individuals that tested negative still ended up showing a positive COVID-19 test several days, and in fact I think their third test was 14 days subsequently. In fact, it was a full 1 quarter. So you imagine that in the practical setting of a business. Imagine you apply the test to people coming back to work and they receive a negative test. Given the data from that study, you cannot rule out somebody having an infection. And if you note the numbers on the subsequent second and third test, we're seeing a positive or a conversion to a positive test. So you could potentially be missing 25%. And in fact, these numbers fluctuate depending on the test that you use. So different tests have different sensitivity and specificity. And indeed, the function of these tests is designed in such a way that it will depend on the population that you're sampling. So the overriding message here is that it is not a simple answer to say we must test everybody one time, perhaps, and get a result back and say they're negative or indeed positive, to say we can return to work safely. And indeed, if you have a second or potentially third test, what is the sequencing? And the timing of those tests is incredibly important relative to when the disease onset. So if you test people, are you going to isolate them for a given period of time? Are you going to retest? The numbers that were picked up in the last or the third test were relatively small, I think in single digits. So perhaps a double testing is the appropriate or potentially the appropriate strategy. But again, this is driven by your individual risk circumstances. And by individual, I'm talking about the business and indeed your employees and potentially the location or the location of your educational facility. So this is a complex area. There are no simple answers anywhere in the information that we have, in part because the information continues to change and update on an ongoing basis. And that's one of the reasons that we really advocate the inclusion of expert medical advice that can help guide you through these challenging questions and problems, to apply the latest in terms of the science and the papers, recognizing that the advice that you receive will potentially change. Use of masks is a case in point. We know that mask usage was originally deemed something that we didn't want people to do. And it wasn't that we believed or understood that it wouldn't help, it was the problem with the available resources. Now that's been resolved and face coverings are available, and we know very clearly wearing a mask is important. So I hope everybody had a happy July the 4th holiday. I hope that it was a safe holiday and one that we continued, and you continued, to wear a face mask in the appropriate setting, preserve that physical distancing, and use appropriate hand and hygiene for yourself as you interact with the surroundings and the people around you. That is the essential component to allow you to return to a safe working environment and a safe, fun environment for us to enjoy all of the great experiences that are available. So, testing doesn't solve necessarily questions as to whether somebody can safely return to work. There's lots of complexity, and you need help in understanding that complexity. If you'd like to learn more, please reach out to us at the link below. And you can find some of those resources on the blog and on the insights that we have. Otherwise, wishing you a happy July the 4th. Hope you had a great holiday weekend. And this is Dr. Nick. I'm the Incrementalist, here with incremental insights for a better business and a better health.